Okay, well, great. Well, thank you, everybody, for joining us for our May town hall. We are so grateful to see so many familiar faces. And as always, one of the most inspiring and powerful things of these town halls as I look around is we see members of the community, families, individuals living with EB, doctors, clinicians, researchers, donors, supporters. And that is really the purpose, to bring everybody together to have impactful conversations. And, when I talk about the community, I think particularly for today's town hall, we want to be very clear that's anybody impacted by EB in any way as a part of this community. And no matter how you've been impacted, no matter your subtype, whether you're a parent of somebody with EB or a sibling or an aunt or a cousin or a grandparent, whether you've lost a child with EB, whether you have a child with EB, you are an integral part of this community. And we're honored to have so many of you with us here united on the call. For this month's town hall, in honor of May being Mental Health Awareness Month, we're here to focus on a very important but often under-recognized topic: mental health and grief in the EB space. This can sometimes be a difficult topic to speak about, to hear about, to discuss, but it's something that deeply impacts every member of this community in a variety of different ways. Whether you're someone living with EB or a parent, a caregiver, a sibling, in any way involved in this community, you are part of this community. And, this discussion is incredibly important. To be honest, it's one that we've thought about for a long time and probably haven't done enough town halls on. And, we knew how important it was. And I think maybe Mental Health Awareness Month gave us an opportunity. So in order to have that conversation, we really wanted to bring experts on board. And the goal for the conversation today is to foster connectivity, demonstrate that nobody is alone, and that you have a team, a community, an army fighting with you, behind you, all around you, as well as provide helpful resources for the variety of different community members joining us today. Today, we are absolutely humbled and honored to be joined by two esteemed speakers and very good friends of mine, both of whom have gone above and beyond to advocate for the EB community and raise awareness for many things, but among those, the mental health aspects of the EB journey. They've started nonprofits, they've hosted podcasts, they've led clinics, and probably above all else, they've been incredibly open and vulnerable in sharing their stories worldwide. And discussing, really difficult topics to discuss, including mental health. You will hear from Dr. Ann Davis, the Herculean Dr. Ann Davis, on her experience with grief via her family's journey with junctional EB, as well as her day job as a licensed grief counselor. And you'd also be hearing from Dr. Jamie Feinstein on how mental health has impacted his work as an EB clinician and changed the way that he approaches the patient journey and his day-to-day. To provide an overview of the format today, we just ask that everyone please stay on mute to respect the speakers. We'll save our questions for the Q&A at the end. We will prioritize the questions that we received in advance, but please, don't hold back. Drop your questions in the chat. Feel free to put them in the chat, or if it's a more private question and you want anonymity, you can send it to Allison McGettigan on our team as a direct message. And we will do our best to get through every single question. And if we don't have time today, we'll take all those questions in and we'll follow up with you afterwards to make sure that anything you want to know is answered. Before I pass it to our incredible speakers, I want to briefly provide some background on our organization, EBRP, and the work we're doing to transform epidermolysis bullosa from the unknown to the unstoppable. And for those that may be new, a little background on EBRP. We were founded in 2010 with one big, bold, audacious goal, and that is to treat and cure EB as quickly as possible, and in the process, pioneer a path for others battling rare disease. EBRP is the largest nonprofit funding research to treat and cure EB, and since our inception, we've raised over $70 million to fund more than 160 innovative EB projects around the planet. The work has led to a transformation of the EB landscape, and I see many clinicians and researchers and doctors on the call that have been part of that, from 2 clinical trials from when the organization began to now 25x, more than 50 clinical trials, over half of which EBRP is directly funded. And of course, we've gone from 0 treatments to, as of 3 weeks ago, now 3 FDA-approved treatments. But, that is a chapter, that is a milestone. It is not an endpoint. Our team is more inspired, more motivated, more focused, more organized than ever before to achieve the ultimate goal of a cure for EB. But along the way, providing, therapies that can be helpful for patients today, as well as resources just like this town hall on mental health. So with that momentum, we are relentless on the momentum to continue along this journey. And while we work every single day and every ounce of our being to treat and cure EB, also raising awareness. The more people that know about EB, the more action that's taken. When we understand, the more compassionate the world becomes. The more people that know about EB, the community feels less alone. And as some of you may have seen, some updates on that awareness and making sure that the world knows about EB in this community. You may have seen events like Venture into Cures, digital and in person. We just launched, and Stefanos, you just mentioned this, the Vetter Cup between the San Diego Padres and the Mariners to raise awareness and support of the EB community through Major League Baseball. And some big news coming up, and it's hard to believe, 2 weeks, we have a feature-length documentary on the EB community, EB families, the medical community. Our panelist today, Dr. Jamie Feinstein, a plug, is in the documentary amongst many other brilliant researchers and families. We've mixed in a little music. So in 2 weeks, that will debut at the Tribeca Film Festival. And then there's plans to make sure that the world sees that in person and in their homes afterwards. So again, the goal is, making sure that the world knows about EB and is inspired to take action, to take it from the unknown to the unstoppable. With that, it is my pleasure to introduce you to our powerhouse speakers today. We are honored to be joined by the unstoppable, relentless, determined, fearless EB advocate, mother to Hallie Grace, Brielle, and Evan, Executive Director of Heroes for Hallie Grace, host of the Grace, Grief, and Grit podcast, licensed clinical psychologist, and one of my very, very, very dear friends, Dr. Ann Davis. I've known the Davis family for almost 5 years now, Ann, and I remain continuously in awe of your family's determination, resiliency, advocacy, and ambassadorship. Coming up very soon, next week, in fact, Ann and her family put on the Butterfly Ball, which is one of the most inspiring EB events you can possibly attend. So if you get a chance and you need an excuse to go to Savannah, Georgia, please join Ann and her community in the Butterfly Ball. It is one of the most powerful events that I've ever been to. So thank you, Ann, for all that work. I don't know how you find the time, honestly. Also with us today, the amazingly talented and dedicated Dr. Jamie Feinstein from the University of Colorado. Jamie is not only a professor of pediatrics at the University of Colorado and primary care pediatrician at Colorado Children's Health, he is also the medical director at Colorado's Children's Health Research Institute, the director of the Clinical Faculty Scholars Program at the Colorado Clinical and Translational Sciences Institute, the pediatric director of the EB Multidisciplinary Program at Colorado Children's, and a remarkable and beautiful writer and powerful storyteller that's been published in some of the most major medical publications. Also, Jamie, just like Ann, is just an unbelievably amazing human being. In addition to that accomplished resume, one of the first times I met Jamie, I was trying to keep pace with him and follow him around New York City as he ran the New York City Marathon for the EB community. So he puts his mind, his time, his writing, and even his body on the line for EB. So Jamie, it is an absolute pleasure to have you with us today. Now, given how important this topic is, it is my job to get out of the way and pass it over to the experts. So without further ado, it is now my honor to pass it over to Dr. Ann Davis.
Okay, thank you, Michael. Wow, what a lead-in. First of all, I just want to say thank you for having me here as being one of the speakers for this. This is a big passion of mine, obviously, for multiple reasons. So I want to start off by just saying I'm calling it Grace, Grief, and Grit because it was fitting, and that is the name of our podcast. So I figured we would go with that for today. I'm going to talk a little bit quick. I'm not going to go too fast, but I have a lot to cover, so I'll get through it as fast as I can. Okay, so my background, I'm Dr. Ann Davis. Call me Ann, though, please. Also, there's a thunderstorm happening right now, so hopefully nothing happens to my internet. We'll see. But I live in Savannah, Georgia with my husband, Joe, and we have 3 beautiful children, 2 of whom are still living. And then we have 4 cats as well, because we are animal people. Like Michael was saying, Savannah is a beautiful city. So if you ever want to come visit, we've got historic downtown, we've got the beach, we've got tons of music that goes on here. We've got the butterfly ball, which I'll talk about in a minute. Just lots to do, and it's really cool. I myself also am a lost sibling. It's not from EB, but my little brother passed away of liver cancer when he was 3 and I was 7. So I have experienced grief and loss throughout most of my life. And that's actually one of the major reasons that I decided to become a clinical psychologist. So that is the job that pays me. I'm a licensed clinical psychologist. I work for the VA hospital. I'm actually on a trauma team, so I work with PTSD and trauma all day, every day, and I've been doing that for almost 15 years now. It's a really tough job, but I love it for the most part. And I chose to work with veterans because I really respect the military, but also as a child who experienced grief and loss, I couldn't work with children. It was just too close to home. So that kind of kept things separate and a little bit more ethical for me. My second job is executive director of Heroes for Hallie Grace, which we founded in 2022 after we lost our daughter Hallie to junctional EB. Since that time, we've raised over $150,000, which is way more than I could have ever imagined. And we donate a lot of that to organizations like EBRP. So we obviously love you guys, as well as Deborah, EBMRF. Our mission is actually threefold. So we raise awareness, like Michael was talking about. We love to do that too, because I always have felt that you can't care unless you know. We raise money, obviously. And then the thing that we're most proud of is connecting with the EB community. So we are determined to help people with EB and their families in any way that we possibly can, which includes things like providing resources, being there to talk to. And then we also have a couple initiatives that are very specific to that. So we provide what we call butterfly bundle welcome boxes to new babies. We provide the Wings of Care initiative, which is basically to help with anything across the lifespan. So that could be like if someone's in the hospital unexpectedly, we could send supplies or whatever they might need. And then we do Forever in Flight memorial boxes, which are hand curated by me. We're also working on kind of an educational piece with the rest of the community from a family's perspective. So that's kind of one of our next goals. And of course, like Michael mentioned, our annual fundraiser is coming up, the Butterfly Ball for EB. It'll be next Friday, so just over a week. I'm trying not to panic, but I'm close. It's going to be phenomenal, though. This is our fourth annual year, and we're actually having it at a new venue where my husband and I had our wedding reception. So full circle moment for us. And you can always come. It's an annual thing. It's a celebration of life for our daughter Hallie, but also to honor the whole community. So anyone who wants to join us at any point, please let me know. And then my most important job, I am a wife and mother. So like I said, we have 3 children. Our eldest is Brielle. You can see her there in that picture. She's now 6 years old and a Spitfire, which is fabulous. We love her to pieces. And then Hallie was our middle child. She's forever 3 months and 3 days old. She passed away in 2021. And then we had our miracle baby, Evan, who is now 2.5, and we believe was sent from Hallie. Evan is actually currently the age that Brielle was when Hallie passed. So lots of interesting parallels kind of going on in our family right now. Yep. Okay. Who is Hallie Grace? So there's our sweet baby girl. Like I said, she was our second daughter. She was born June 5th. Of 2021. So we're coming up on her 4th birthday, and then she passed September 8th of the same year. When she came out, she actually had very minor blistering, so they weren't even sure it was EB right off the bat. And I think we were all kind of surprised to learn that she had junctional severe. We didn't exactly know how that was going to play out, but obviously it didn't play out very well since we only had her for such a brief time. However, that time was incredibly special. When she came out, I had a C-section with a clear drape, and the instant I saw her, I actually had a feeling like I had known her before. I've never experienced that before in my life, and it was the most special feeling I think I've ever had. I remember actually gasping, and the anesthesiologist got a great picture of it because it was just this incredible moment where I was like, I know you. So very, very special connection with her. She was our judgy baby. So So she was very calm and observant. She always furrowed her brow and observed her surroundings. Didn't really cry a whole lot, shockingly, because I'm sure she was in quite a bit of pain. But it was a loving nickname that we had for her. And then the one thing that stands out more than anything were her eyes. She had very deep, beautiful eyes that would just see right through you, which I've learned since that time seems to be kind of a common denominator throughout this community. And then Baby Mine is on here because that was the song that I used to sing to her to calm her down. And then I would give her little nose nuzzles. So Baby Mine, I always call her my Baby Mine. Okay. Community. One of the main reasons I actually wanted to do this town hall. You can see here that we love this community. I actually could have added so many more pictures, but I was like, it's going to take over the entire slide. So I tried to narrow it down. The way that we found the EB community that has been so incredibly welcoming to us was actually social media. So we were very lucky that when Hallie was born, social media existed, because I know prior to that, a lot of kids grew up not knowing that anyone else had EB and they felt very alone. Parents, I'm sure, as well. And so for us, basically, I posted in any Facebook group I could think of that I was a member of that, you know, we needed prayers for our daughter. And several fellow EB moms reached out almost instantly. I mean, Hallie was like a day old, and basically moved me in the right direction to the EB Facebook groups. And I got to know these people, and I cried to these people, and I vented to these people, and they were just so incredibly supportive and welcoming. And so there's a bond there that is unlike anything I've ever felt. And then when I got to meet any of them in real life, it has just been the most emotional and healing moments for me, because I mean, they were there for me more than some of my best friends, you know. So they're chosen family, basically, for the rest of our lives. Okay. So that was all the personal stuff, and I can relax a little bit now because I get to talk more professionally, because that was obviously the hardest stuff to get through. I want to talk about mental health and wellness. And if you'll notice, I said health and wellness. I didn't say illness. So oftentimes in the world of stigma, we talk about mental illness, and that is a really negative way of looking at something that pretty much everybody has. Mental health refers to a person's emotional, psychological, and social well-being. It affects how we think, feel, and act, as well as how we handle stress, relate to others, make choices. It's important at every stage of life, from childhood to adulthood. And just like physical health, mental health can fluctuate. It can be impacted by other things like trauma, grief, chronic stress, genetics, brain chemistry, environment, etc. It's really important to prioritize, just like physical health, because it's actually part of our overall health as a human. Okay. Emotions are a big component of this, and I think people don't talk about this nearly enough. So when I do trauma work with my veterans, we actually talk a lot about just emotional intelligence and growing emotional vocabulary. We all have this idea that good mental health means you have to feel happy all the time, and that's not a thing. Nobody feels that. Nobody thinks positive all the time. Nobody feels positive all the time. It literally isn't what it is to be human. So basically, good mental health is actually all of this: coping with life's ups and downs, managing emotions in healthy ways, maintaining relationships, feeling multiple emotions at once, and they can actually be opposing emotions. So you could feel happy and sad at the exact same time, and a lot of times you don't learn that. Functioning in daily roles and responsibilities, and seeking support when needed. And one of the main things we talk about in our group is that all emotions are good. They may not feel good in our body. They might be uncomfortable, but they serve a purpose and they give us intel or information. So basically, knowing that emotions can just help us figure out what we need allows us to know that we can allow ourselves to feel that. And basically, the healthiest way to get out of an emotion is to move through it. So just keep that in mind. The WHO needs mental health care. Literally everyone. I put this in capital letters because it is so important. Again, there's such stigma out there about mental health care, but again, we're talking about mental health, not mental illness. Okay, so we're looking at everybody could use some improvement. Everybody has got some sort of anxiety or depression or something that we could work on because we're human beings and no one is perfect. And then you add a rare chronic condition to this, and obviously that just kind of ups the ante here. It impacts everybody from family and friends, the outer layer, right, to the caregivers themselves. And then unfortunately, sometimes people stop there and they don't think about the patient, especially if we're talking about children. So both children and adults need mental health care, just like they need physical health care. It's part of their overall mental health and physical health well-being. Children are impacted too. They just understand it and express it differently. So it doesn't mean they're not feeling it, and we need to make sure that we're mindful of that. The what? This is a really quick slide. I like this one. Basically, this is all the stuff that comes along for the ride. Potentially. And I just put the ones that are probably the most common when dealing with a chronic condition. So we're talking about anxiety, depression. OCD is that obsessive compulsive component. Oftentimes that comes up if we feel like we're not in control of other parts of our lives. And so we try and control other things. And then, of course, trauma, post-traumatic stress disorder, and specifically medical trauma is a big part of that. And then grief, which I'll talk a little bit more about in a minute. The how. This is how to start addressing good mental health care when you're going through so much. So emotional coping strategies, mindfulness, breathing practices, progressive muscle relaxation, etc. Self-care is super important. We talk about in our groups all the time, fueling our health tanks. If you think about it like a gas tank in a car, the car can't run on empty, and neither can you. So doing little things every day to fuel your own tank can make you a better care provider for somebody else around you. It can make you a better friend, a better spouse, a better parent, all those things. Getting general support from loved ones is incredibly important. Social support is really big in terms of mental health. Having knowledgeable medical providers who actually listen to you, which will be a big theme in this. And then professional help and therapy. And I put 3 exclamation points because people don't want to do it. They think that, I have to kind of prove myself that I'm tough and I don't need additional help. And I'm actually here to tell you that getting professional help takes so much courage and is actually the bravest thing that you could possibly do. And we're going to go into that a little bit more in a moment too. And then spirituality can be important, if that's something that is important to you. And of course, remembering that you or your family member is so much more than EB. The why. So why is this important? Why does mental health matter? It supports healing and growth, developing healthy coping skills, reducing isolation and loneliness, affirming meaning and value, which adds purpose to your life. And there's been a ton of research out there that talks about how important the feeling of purpose is. And then it actually can prevent crises and suffering, not just emotionally, also physically. So there is actually a mind-body connection. And it is not made up. I think oftentimes people think, if you're stressed out and you have a headache, that's just you convincing yourself that you have a headache from stress. No, there's actual physiological things that happen to your body. You can have over time some cardiology stuff, blood pressure stuff. It's very important to care for your mind because it does impact the way that your body functions as well. Okay, so grit. This is all the hard stuff that we get through, right? And I have 2 lists here. I had actually compiled these last year. Some of it is from our own personal experience, but also I've talked to people in the community because I feel like my perspective isn't the only one that matters. So these are just certain things that we came up with. It's obviously not an exhaustive list, which is why there's some blank lines there because you could fill that in with whatever. But we're looking at things that the families go through. We're also looking at things that the patients specifically go through. And, you can see on here missing out on events, hopes and dreams, medical fear and trauma, pain, all of that stuff is really important to pay attention to when you're looking at mental health goals. So this is my wheelhouse, grief. I love talking about grief, and I also hate talking about grief. It's not just about death. So everyone on here is probably experiencing grief in some way. It's very unique and personal. What is grief officially? The actual definition is that it is the natural anguish experienced after any significant loss. So then you might ask, what is loss? Loss is the fact of no longer having something or someone, or of having less of something than before. So essentially the subtraction of something from your life. And that can mean many different things. You could have physical grief, emotional grief, social grief, anticipatory grief, which is, expecting grief to come, some sort of future loss, ambiguous or unexpected loss, and of course the one that we all think about, which is bereavement. Everyone here, like I said, is probably experiencing at least one form of grief. So it's important to think about that when you're thinking about getting professional help or what you need to be working on. There's no right or wrong way to deal with grief. Everybody handles it very differently. A lot of times we get praised for, staying in the EB space and doing all this stuff for Hallie. And I love doing that. And I'm very happy that we're doing that. But also some people choose not to do that. And that's okay too, because it really is personal for you and what it makes sense for you and your family. And then I just want to say I love this graphic because I think people have this idea that time heals all. And so the top line there is what you typically think of, is that grief shrinks over time. Not true. The bottom is really what we're dealing with. So grief stays, and then your life kind of expands and shrinks around it. And the size of the jar can change depending on the day and what's going on. So you might move between that. It's not a linear process. And now it's time for grace. Self-compassion is so, so, so important. In fact, literally earlier today, I did a group on this at work where we did a whole exercise on drawing a self-compassion heart. And it's my favorite thing that we do, is defining that for everybody, because it looks different for everyone. But giving yourself grace is part of that. Also, slowing down and acknowledging that rest is still doing something. A lot of people feel guilt about resting, myself included. So oftentimes I say this to myself as well. But rest is actually restorative. It is needed by your body. It is something that you need to do. So you don't need to feel guilty about taking a nap if you need that, or slowing down and watching a fun movie or something. Healing is not linear. So I always use this phrase. This is my favorite. I'm known for it. I did not come up with it, but I say it a lot. Progress, not perfection. It's the reality. You're going to stumble. You're going to backslide a little bit. You're not going to feel great all the time. And that is completely expected and okay. Honoring it all. This is allowing yourself to actually feel all of the feelings that you have. You don't have to wallow in it, but feel it. Again, avoidance really isn't going to serve you long time. So the more you can allow yourself to feel it when it comes up, even one of the things I've heard is set a timer. If that helps you, if you feel like you're going to get stuck in it, set a timer for 15 minutes and allow yourself that time. And then when that timer goes off, then you get back to your life and you go on with your day. Remember that feelings give us information, and that the only way out is really through. And then I said this before, but seek support without shame. I'm going to say it again and again and again. You can feel confident in the knowledge that reaching out for help is the literal bravest thing that you can do. Avoidance is actually the easy route because you don't have to feel it. Facing it takes a lot of courage. And I say that as somebody who watches people face this stuff day in and day out. And I'm so incredibly proud every time that they do that, because I know that that is not the easy route and that they have to make a conscious decision to do it. So I hope that that can kind of change the mindset a little bit about seeking support, being something really brave that you can do for yourself. And then that brings me to vulnerability. And I'll talk about vulnerability a little bit more later in terms of what I've learned in my own journey. Vulnerability is scary. And so a lot of people don't want to be vulnerable. I'm not going to lie. Some of what we talk about today is vulnerable for me, and I was feeling very nervous. But being honest and vulnerable, including with yourself, can help bring back more power and control to your own thoughts, emotions, behaviors, relationships, all of those things. It's actually one of the most empowering things that you can do for yourself in appropriate situations, of course. Now, if you're looking for professional mental health care, I wanted to have a brief slide on what you should actually be looking for. And I'm happy to answer anyone's questions specifically after this if you need help finding someone. But essentially, you want to find somebody who is a licensed mental health professional. And that includes people like me, psychologists, but it could also be a social worker, a licensed professional counselor, anybody who is licensed in their field, marital and family, all of that. You also want someone who specializes in what you're actually looking to work on. So if you want to do trauma work, get someone who specializes in trauma. If you're looking to work on depression, please find someone who talks about working with depression. I can tell you, you do not want me if you're working on OCD. I just haven't worked with that in a while, and I'm not going to be the best help. But if you want to work on trauma and grief, I can't be your therapist, but that would be the way to go, is somebody who knows that specialty. You can find people through your insurance or local mental health clinic. Also, I thought of this later. Sometimes if there's a grad school in your area, they have student clinics that operate on like a pro bono or sliding scale. I used to work in one of those. And so if you're looking for someone, they need the practice and they're actually supervised. So it's a really good option if you've got someone near you. And then I just wanted to make a note that psychiatrists are fabulous for medication. They can help with that, but oftentimes they have a really large caseload. And so you're not going to want to think of them for doing like in-depth therapy care. So you might need both, a licensed like therapist and then also a psychiatrist if you want to add medication to the rotation as well. Okay, the work. This is a slide I could literally talk about for an hour, so I'm going to go through it really quick. And there's actually a handout that I can pass on to EBRP that they can email out that I put together, and it's got all of this information in it, so you can look through it. But there's all kinds of treatments out there with varying levels of intensity. We've got supportive talk therapy, both individual and group. This is stuff like support groups. You can find it through like hospitals, churches, hospices. These are not structured, however, so just be aware that they don't have like a specific protocol that they're doing. There's also many types of therapies available to help with coping skills for specific types of things like depression, anxiety, etc. And so I can help you get more information about those if you want. Trauma-specific therapies, we also call them EBPs or EBTs. These are evidence-based treatments. This is what I do. We literally have like workbooks that you come in. There's actual curriculum. They are a little bit more intensive though, because you might have to process your most distressing event or events either out loud or on paper. And so just be prepared if you're going that route that it could be a little bit more intense. Please make sure that you find someone certified in trauma care if they're doing that specific protocol or a specific protocol for trauma. And then there's things like the higher levels of care, day programs, residential programs. This is where you would go multiple times a week, or you would actually stay there if you needed that level of care for a little while. Okay, so if you're asking yourself, how do I help somebody dealing with stuff? I just put a couple of examples here. Again, the theme is listen. It's in all capital letters. You don't have to fix anything. Just being there is so important. Don't make any assumptions and ask questions when appropriate so that you can clarify how to be helpful. Please remember that EB is something that they have or their family is dealing with. It is not who they are as a human being. So there's lots of other components to them. Help them share the load. This is actually being willing to sit with somebody in the heavy emotions, letting them know that they don't have to worry about making you comfortable, that you're not going to judge them if, you know, you're crying or they're crying, or if anything comes out, that there's allowed to be vulnerability in that space, that safe space. I also tell people to offer practical and specific support. Please do not say to somebody, let me know if you need anything, unless they're just like an acquaintance that you really don't know very well. But if you know this person at all and you care about them, they are not going to respond to that because that puts extra burden on them. So I always tell people, give a list of options of things that you would be willing to do and let them choose. Can I fold your laundry? Can I get you dinner? Can I do your yard work? Can I send a house cleaner? Whatever it might be, give them specifics, and then they can just pick one, and it takes the mental load off a lot and makes them feel like less of a quote unquote burden, which they're obviously not. Continue reaching out. So this is consistently maintaining relationships by checking on people. These are lifelong journeys. If these are people you care about, don't think that you help once and then you're done, because then they're going to go right back to feeling alone. This doesn't have to be a daily thing. I know that we all have really busy lives, but just every so often, if you're thinking of them, shoot them a text. Hey, I'm thinking of you today. Or, hey, can I stop by and say hi a little bit later? So just over time, kind of building that relationship and being in it for the long haul is really important. Also, I just wanted to specifically mention, if they have lost a loved one, let them know that you remember that loved one. For the most part, unless they tell you otherwise, you will not make it worse by bringing that person up. They are already thinking of them. So whenever somebody tells me something about Hallie, they saw a butterfly and it reminded them of her, or whatever it might be, I thought of her because her birthday's coming up, whatever, that literally makes my day. Like, more than anything else that anyone could offer, just saying her name and asking me or telling me about her is everything. So I just always encourage people to do that, unless someone specifically tells you not to. Take care of yourself too. We've talked about this. Self-care is very important. It isn't selfish. It is actually selfless. It makes you a better caretaker for others. And then a real quick list of the dreaded don'ts, or the do nots. Don't judge them. You're not in their shoes. Don't put time limits on feelings. Don't use cliche or invalidating phrases such as at least, only, just, I can't imagine. I know these are things that are really well-meaning, but if you don't know what to say, you can literally say, I don't know what to say. This is hard and I don't know what to say. Or you can just say, I'm here for you. Those are really easy options to substitute in if you're worried about saying the wrong thing. And we all know that these are well-intentioned, so I never take it as like an anger thing, but I'm just trying to give a little bit of advice here on that. I think that's that slide. And then I've got this specifically for providers. Now, some of this actually came from individuals in the community. Some of this whole presentation came from individuals in the community. It's not just me. But these are some important points that I heard and I wanted to make sure we touched on. So listen, really, really listen. Create the safe spaces, allow the patients and families to be vulnerable. You will get so much more information out of them, which will help you so much. Accept that the patients and their families are experts too. They are experts on their own lives. So please don't discount what they're saying. Obviously, you are a professional and you know a lot of stuff, but it should be a collaborative process in the room for both mental and physical health care. Open and honest conversations. Please have these even when they're hard. If it is something where you have to tell somebody that, there's really bad medical news, or it's a life or death thing, or, there's a really big risk about it, if you do not give all the information, they are not going to make educated and informed decisions, and that is going to lead to a lot of trauma and regret. So the conversation might be hard in the beginning, but ultimately it leads to so much better outcomes later. Offer all viable options, and then actually support the decision, even if it's what you wouldn't choose. So just make sure that if you're going to offer it as an option, then you got to be there with them if they decide to go that route, because it's going to always be different for every family. Offer to explain everything. This is if they want. Sometimes people get really weirded out by this. I personally have my anxiety eased when people tell me like what to expect. Like, the unknown is the worst for me. So I'd rather you give me all the details. So just kind of check in with them and make that an option, and make sure that you're explaining it in a way that they can understand and that doesn't come off as condescending. And then be there for them. Don't treat them like a chart or diagnosis. Make sure they know that they're more than their diagnosis. It's just going to lead to so much better outcomes when you've got humans in the room together. That bedside manner is so, so important. And then, of course, take care of yourself too, because this is hard work. And so you can't pour from an empty cup, just like I've been saying. There's a couple themes throughout, I know. We're almost done, I promise. Okay. So what have I learned? A couple of things. You can do hard things. I can do hard things. I never thought that I could pop blisters and do wound care. It's actually why I went into psychology and not physical, medical, healthcare because I just didn't think I could do it. But to be perfectly honest, it was an honor to care for Hallie, and I miss doing it. And I survived it. You've survived hard things in the past. You will survive hard things again in the future. You can absolutely do it, and you can hate it the whole time or think that it sucks, but you will actually get through. Grief is love with nowhere to go. I used to get really mad at how hard the grief was, and then some days it would lighten up and I would get mad at that too. And so I have actually learned to really appreciate the grief because it is an ode to the love that I have for my baby girl. And that goes for anything. That's any type of grief. It doesn't have to be loss. Grief equals care. You know, if you feel something like this, it means that you care about it. So just learn to kind of recognize that as one of those emotions giving you information. The next one is still hard. I'm working through it. God's plan doesn't always match my will. And this is obviously a personal one to me. Not everyone holds the same spiritual beliefs, I understand. But for me personally in my journey, God has really shown up for us. And I have a lot of beliefs about what he has done for our family. It's not the way I wanted it to play out, obviously. And so there was some anger. I get in my own head about it. I'm still learning to trust and come back to him. But ultimately, I'm so grateful for everything that he's done for us. And I know that he's got my Hallie Grace safe. So I just have to trust the process in the meantime. I mentioned vulnerability before. It's so, so important. The people that I've met in this community, the reason that we are so close is because I have been able to cry to them and they have been able to cry to me. I've had phone calls with these people where I've bared my soul in a way that I didn't think I could ever bare my soul to anyone outside of maybe my parents and my husband. They have seen me at my absolute worst and we are better for it. So when you feel like the situation is right, if someone is there to support you, don't hesitate. They won't judge you and they will just match you in that vulnerability, and it will be the best connection you'll ever have. Learn to accept help. This was hard for us. It's not weak. It's not a handout. People want to help you. Let them help you. It takes away the opportunity for someone to do something for you when you shut it down. And then finally, and this is probably the hardest one for me to talk about, so I'm praying I can get through this without getting emotional. Everybody is impacted. You can see on these pictures, these are my beautiful children. The picture on the right is Brielle going to a grief camp 4 weeks ago, overnight by herself at the age of 6. She did phenomenal. She opened up. She learned so much. But there is some heavy, heavy stuff in her. Children actually re-grieve at every developmental stage. So do not underestimate them. She was only 2.5 when Hallie died. She was 2 and 3 months when she was born. And so a lot of people would think, oh, she's too young to remember. Thank goodness. No, this child remembers and has re-grieved her sister every single phase, and she will continue to do that the rest of her life. I have done that with my brother as well, and so I can understand. And then Evan, poor Evan, never got to meet his big sister on this side of heaven. And so he is going to grow up very confused, wrestling with a lot of things. So I'm specifically talking about siblings, but everyone's included here. Grandparents, aunts, uncles, cousins, friends, family. It really does impact the entire system. So just kind of keep that in mind and make sure that you're checking in on everyone. I just mentioned siblings because oftentimes kids are left out and they need to be included. And I made it. Resources, I put in here kind of funny me. I put my email here, and this is what Heroes for Hallie Grace is created for, to be here for the community. And since I am a therapist and a psychologist myself, if I can help you find a professional to give you the mental health care that you need, if I can help talk you through the different types of therapies and what to expect, I'm really happy to do that. So please do not hesitate to reach out. This is the cover of the handout that we'll send out to everybody. It's got a lot more information in there. I could talk forever about it. Look for professionals in your areas or ask trusted providers because they might have someone they regularly consult to as well. So if you need anything, I'm here.
Thank you so much, Anne. I mean, Really, truly, that was a master class, and it was inspirational and powerful and valuable and emotional, but really above all practical. And you talk about grief and all the people it impacts, and it's a tribe, right? And you gave us wisdom and knowledge for every person in that tribe. Also, I think I speak for all of us, just listening to you speak and the way that you deliver information that's incredibly hard and challenging to deliver. Um, made all of us more present and calm. And, I think I'm going to, not that you have a spare minute in the day, but I like you on the Calm app every single day to kind of talk us all through it because it was really powerful. And, you also mentioned the importance of remembering and paying tribute and honor to those that aren't with us anymore. And, Halle Grace, we think about, if not every day, constantly, and it inspires us to work harder. It's why you're here today, helping this community. And Katie, I echo, her sentiments of how much she continues to inspire us, and will forever inspire us. So thank you. The last thing is, you mentioned, grief is love with no place to go. And you also mentioned everybody's journey is different. And there's so many that have experienced grief in this community and in many other communities. And there's no right or wrong answer. And I see Trish on this call, I see Katie and probably so many others. But, the word hero and selflessness and these things are thrown around so much in our culture and our society. But you have found a place to direct that love, in the face of grief, and to give back, and to be, a leader, an ambassador, and an advocate in this community, and spend time today. It has to be so challenging and difficult, but to use your words, you found a place to direct that love, and you've made that jar a little bigger around it to the benefit of people around the world, really, truly, that you benefit. So just so much gratitude and appreciation and love and thanks, and thinking always of Halle Grace and you, and all the wisdom that you've given us today. So I know you said, I'm getting through it and it's almost done, but we all could have listened to you for days. So thank you so much, Anne. And I know we'll get to some questions at the end as
Yes.
well. And again, any ones that we can't answer, thank you for offering up yourself as a resource. Speaking of people that are directing their love and their brains and their expertise and their intelligence, it is now an honor to pass it off to Dr. Jamie, who, far beyond his work in the clinic and on the research side, has taken all those extra steps as well, to think around really that tribe and how everybody's impacted and what he can do in his role and his part, with his knowledge and expertise in this community. So, Dr. Jamie, it is a pleasure to pass it over to you.
Fantastic. Thank you so much. And thank you, Anne. That was absolutely incredible. It's really an honor to present alongside of you and in memory of Halle Grace and so many others that we hold in our hearts always. So thank you to the EBRP team also for shining a light on this really important aspect of living with EB. I'm going to talk briefly about several things very similar to what Anne spoke about, but from the perspective of an EB doctor. And I think for many of these issues, the more we talk together as a community, the more it normalizes and opens the space to share and to help each other. So we'll go to the first slide, and I'll just open with something a wise 9-year-old child with EB said to me. He said, "I think everyone in the world should have a therapist." He didn't say that to be silly. He said it wholeheartedly, and I could not agree more. Each of us, myself included, can benefit from working with somebody outside of our usual orbit. A guide, a coach, a listener, somebody who helps us think, process our feelings, and grow. Living with EB or caring for someone who does, it really brings that whole full range of emotions that Anne described. It's joy and pride. It can be sadness and fear at the same time, strength and resilience. These are all really important feelings that we need to acknowledge and give space to explore. When I see patients in clinic, I always invite children and their families to openly discuss feelings and emotions at every visit. And I really do think this should be a part of every EB visit, every healthcare visit with your doctor. And for a long time, we have focused on treatments and physical interventions, and for very good reason. But none of those things are truly effective without prioritizing mental health and well-being. We'll move on to the next slide. And I just want to share some of the things that we do from our team's perspective. So over the last decade, I've been really proud of our entire EB community's efforts to embed psychologists, social workers, child life specialists, and a variety of other types of therapists into EB care teams. And these team members really offer safe and meaningful ways for kids to express emotions, to ease their anxiety, and find joy. And so many of these children and teens that I've worked with really have been, they've developed these incredible, beautiful talents. Um, they are incredible musicians, artists, actors, computer game programmers, you name it. It's incredible to watch these children build unique identities that foster their strength and their confidence and their resilience. And it means that EB is one aspect of their otherwise very full and colorful lives. So in the medical setting, we follow a trauma-informed care model, and we recognize that past medical trauma, especially for people with EB, working hard to minimize harm in the future can really reduce anxiety and suffering at every subsequent visit. So every interaction that our team has here in the hospital, but also at home and in the community and at school, it's our chance as a community to help kids feel safe and supported. And I will say that sometimes therapy isn't enough. And when needed, medications, things to treat anxiety or depression, they are safe, they are effective. And even for kids with complex medical conditions, even for young kids, they can be hugely beneficial alongside working with a therapist or a psychologist. So I would invite you to ask your care team if this might be something that would be helpful. And then finally, caregivers need support too. So parents, siblings, everyone carries emotional weight. And expanding access to therapy, especially it's a silver lining of, I think, COVID, where telehealth became norm, has been a game changer. We've really been able to support virtual therapy for parents, for caregivers, for family members, and we've heard back that it has been so incredibly helpful. So I'd like to move on to next and just speak briefly about quality of life. For a long time, I think people have associated pediatric palliative care with end of life. But in reality, pediatric palliative care teams are the experts in symptom management and in helping kids live the fullest, most joyful lives possible. Engaging with these teams early makes a huge difference for patients, for families, and for providers. And this kind of support isn't about giving up hope, and I can't stress that enough. It's about investing in quality of life, quality of time together, and the quality of connections. One parent who I respect very much, who for a long time feared and felt guilty about engaging with the palliative care team, she emailed me out of the blue a couple of weeks ago and shared that she and her daughter had started working with the palliative care team. She said, quote, "Embracing that it is normal to hold grief and joy at the same time is probably the most important thing I ever learned. We have made so many beautiful memories together because of that shift." And I think that speaks wonders about what pediatric palliative care can provide for families, for communities. And then finally, I just want to say a few words about grief and loss. When we lose somebody, whether it is a child, a sibling, a friend, or a patient, it is absolutely devastating. And the impact, it ripples across entire communities. So there is no right way to grieve. But I really do believe that the more we talk, the more we support each other, the more we can start to heal together. Over my 15 years of practice as a complex care pediatrician, I have attended more funerals than I can count. And I have found that families really value knowing that their child is remembered and honored and loved by their physicians and their care teams, even after a child's death. So the last thing I want to say is that we all grieve in different ways, and everything is the right way. Everything is normal. For me, I process big things by writing, and I'd like to finish by reading a short essay that I wrote that reflects on many emotions that come along with loss. So while I read this, I invite you to close your eyes or go off camera and maybe think about someone important to you, someone you miss. This is the first time I've read this out loud, so if it catches me, I apologize if my voice wavers a bit. So this is called Learning to Say Goodbye. It's no surprise you don't sleep at night, said the therapist. I had just told him that I care for children with epidermolysis bullosa, a rare and life-limiting genetic skin disorder. In children with this disease, the slightest shear force causes their fragile butterfly skin to separate from the dermis below, leaving behind a battlefield of open wounds. Over the past 15 years, I have stood guard from birth to death over so many butterfly children. To carry on, I separated myself from the stories of their deaths, storing those hardest moments in the recesses of my mind. Yet in the quiet of the night, memories of their faces and voices often visited me. The therapist nodded, pausing before saying, I think it might be time for you to figure out how to say a proper goodbye. I remember the first time I didn't say goodbye. I had been working for the previous year with Steve Berman in the country's largest epidermolysis bullosa clinic. Well into his 60s, Steve possessed an energy unparalleled by anyone I had ever met. So I wasn't completely surprised to be jolted out of sleep at 2 a.m. one night to find his name lit up on my phone. Jamie, I'll stop by to pick you up on our way to the hospital. Hannah's dying. 20 minutes later, we walked into a quiet intensive care unit. Steve had known Hannah since her birth, and she had just celebrated her 16th birthday. Now she lay there unconscious, septic, her eyes closed, her face swollen from kidney failure. I stood silent and motionless, a very young attending physician not wanting to do anything that took the focus off of Hannah and her family. Throughout my medical training, I had been told, or perhaps I had told myself, that a patient's death was not supposed to be about me. I needed to be present for the medical needs while being invisible for everything else. So it surprised me when Steve bent over Hannah and he gently placed a kiss on a small patch of unaffected skin on her forehead. I'm so proud of you, he whispered to her. It's okay to rest. Later, Steve pulled me aside. They are my family, Steve said. I've been with these kids and their parents their entire lives. I can't walk away without kissing them goodbye. It took me several years of visiting bedsides and attending funerals with Steve before I took his advice. The night I finally did, I was standing guard in the hallway outside a hospital room of Ram, a 7-year-old with a severe form of EB that resulted in heart failure. I knew that Steve was out of the country, but that he would want to know that Ram was dying. When Steve's name finally lit up on my phone, I explained the situation. Will you make sure to tell Ram I'm proud of him? He asked from the other side of the world. I assured him I would, although I didn't quite know how. Steve and I had both taken care of Ram since his birth, but Steve was his family's anchor. Now I was the one standing in the hallway, escalating pain medications, and with each increase, I felt like I was stealing time from his parents. Working up the courage to ask for time with Ram, I quietly entered the room. Dr. Berman asked me if I could say goodbye to Ram for him. The parents nodded, then added, Dr. Feinstein, thank you for being a part of our family. Ram has always loved you. I walked over to the little boy who was snuggled in a fleecy orange blanket. His eyes were closed. Ram, it's Dr. Feinstein. Dr. Berman wanted me to tell you he's proud of you. I said, I'm proud of you too. And then I did something I had never done before. I bent over Ram's face and I lightly kissed a soft patch of perfect skin on his forehead. It's okay to rest, I said. When I pronounced Ram dead an hour later, I knew that I had wanted and I had needed to say goodbye and that I almost hadn't done it. It was now becoming clear to me that at the end of life, I was a part of each child's story, and equally important, that child was a part of mine. And when I stopped insisting on separating my patients' stories from my own, I began to acknowledge that I too needed certain things in order to find a sense of peace. My work with the therapist was helping me understand why Steve needed to kiss his butterfly children goodbye. Although I would have been content to end the life lesson there, I remember the moment when the world decided to come full circle. I was on the indoor rower in my icy garage when Steve's name lit up on my phone. A nagging worry that I had been suppressing set in at full force. I hadn't seen or heard from Steve in the several weeks since he had finished immunotherapy for an indolent lymphoma. When I answered the phone, a soft, unfamiliar voice asked, "Could you come to the ICU to see Steve? He's asking for you." 20 minutes later, I walked into the adult hospital, which was strikingly devoid of the balloons and the flowers that were painted on the walls of the children's hospital next door, where Steve and I had worked together and cared for children with EB for nearly 15 years. I arrived at the ICU bay where Steve lay, and behind the dialysis catheters and jugular lines, his wiry white hair was unmistakable. I felt a quivering start from somewhere deep in my body. "Who is that?" he asked. "Hi, Steve, it's Jamie," I replied. I leaned in, and his crystalline eyes focused directly on mine. Never one to skirt the truth, Steve said, "Jamie, I'm dying. I wanted to say goodbye." "I know, Steve. I want to say goodbye too." We spoke for several minutes, and Steve asked me if I would give a eulogy at his funeral. Then he beat me to the words that were on the tip of my tongue. "I'm so proud of you," he said. Still up close where he could see me, I hovered over him, and I touched my lips lightly to his brow with the weight of a butterfly landing on a branch. I didn't want to cause any more pain, but I wanted him to know I was there. His skin was soft and warm. "It's okay to rest," I said. But I knew I needed one more thing for myself. "I love you, Steve." "I love you too, Jamie." I turned and walked peacefully away. In the years since Steve died, I have also started to say proper goodbyes to the many children who used to keep me company in the darkness of night. Now, when their faces appear in my mind, I take the opportunity to remember their stories, to think about the parts they have played in shaping my own story, and a little late, but better than never, I tell them out loud that I love them. Then, having returned the energy of those memories back into the world, I sleep. So I'm going to end by saying, I hope that everyone on this call gets what you need from whatever difficult situations lie ahead. Never be afraid to ask for help. And if you don't know how, that's okay. That's why we're here. Please lean on this beautiful community that we have, and we will find strength in each other. So with that, I will say thank you for listening, and thank you for including me in this conversation today.
Thank you so much, Dr. Jamie. And, the same praise to you as goes to Anne. I mean, these are incredibly difficult things to talk about. And, what I learned from you both, and I'm sure we all did, although many may have known it, is that two emotions can exist at once. And I think what you've both shown is simultaneously incredible vulnerability, but also courage to share that vulnerability. And, just really, really thank you both. And, Jamie, your accomplishments, as a clinician, as a researcher, as a director, as a publisher, all the things that you do, I think we would all agree, we add poet to that list, being able to articulate that in a way to all of us that draws us in and finds common ground. And, being a doctor like you are, and like, it's not the only job, but certainly on that list of ones that are so overworked, and there's never enough time in the day. But, you've chosen to find the time outside of that treatment room to serve the community in so many ways. The family component of it that you mentioned, to write, to think about things probably beyond your scope of work or your job title. And it's just the harder thing to do. So just thank you so much, Dr. Jamie, Dr. Ann. This is a hard one to do. But as we learned from both of your presentations, sometimes we need to do the hard things. So to open up these conversations with experts like you is truly a gift, and the first of many conversations to come. So I want to thank you both. And I'm just looking at the chat and all the thanks and praise as well. So I know that's shared by the whole community for your time, for your expertise, for your knowledge, for your compassion, and for your equal parts vulnerability and courage as well. So, with that, I want to make sure we have a lot of questions and we'll get to as many as we can. But just as a reminder, we're going to prioritize those questions that came in advance. Feel free to drop more in the chat. If it's a more private question, you can direct message the amazing Allison McGettigan on our team or email allison@ebresearch.org. Whatever we don't get to in the time today, we will be sure to get to after the fact and follow up. But the first question, and a bit of commentary, but also a question, is feelings of self-esteem, worthiness, confidence, and well-being are essential to a happy, well-rounded child. With a disease as visible as EB, what are some helpful ways to interact and talk to your child with EB or their siblings about how to cope with the inevitable questions, comments, looks, and possible rejection from other people and children? And then the final comment is there's so many challenges to good mental health. In the best of circumstances, EB just adds another layer. So the question really being, any advice that either of you have on how to talk to either your child or sibling or other family members.
So I'm trying to get over what you just read, Jamie. I'm sorry. That was incredible. Yeah, I think there's a couple of things that I would say. One is kind of what I had talked about in the presentation about knowing that there's so many other components. So finding the areas that that child is very confident in, that doesn't necessarily relate to EB. So, if they're a really talented artist or dancer, or, they love music and they love to sing, whatever it might be, I think building their confidence in other areas can be incredibly helpful. And then just, again, making sure that we're, checking in on them, getting them in mental health care. There's all kinds of things for children, all the way down to like play therapy, like where they go and they don't have to talk. They can literally just play with things. And there's a therapist there that kind of guides that as well. So just making sure that we're involving the patient and the siblings in that too. That would be my answer.
And I'll just add, one of the things that we found so helpful is helping educate the community and the kids and the families around this, the child and the family that are living with EB. There are a lot of resources, and I can pass some of those on. Steve Berman, who I just talked about, he led the way by developing some school videos that teach in the classroom, teachers and schoolmates who are young, kindergarten age, what EB is and how to be a good friend to somebody who's living with EB. And that is a really powerful way of creating space around this. So I will pass on some of those links. They are freely available videos that are totally appropriate for school and really helpful.
Thank you both so much. I'm looking through this long list of questions, and you two wise souls have proactively answered most of them like you would have anticipated them, being the professionals you are. But maybe one more, and then again, encourage the questions just to continue to come. But there was a question about, is there any thing new over the last couple of years or recent theories that have changed or different practices for the EB community or otherwise in mental health of note, things that may be different today than they were a few years ago, things that are new resources or new approaches for the community?
So I haven't been in the community many years, but just based on the few years that we've been in it, and then also speaking to other community members, I think the main thing that we've all noticed, or at least the common thread, is how much more it's being talked about. So even this specific town hall, I think, is a huge step forward. Like you said, this is such an important topic, and we need to be talking about it more because it is kind of the overall health and well-being of a person. And I've had several people tell me that, like, back in the day, it wasn't a thing. Like, we just didn't talk about mental health, and it was all about, the physical aspects of things. And just even in the time since we had Hallie, I've noticed that people have really kind of leaned into that more. So I don't have like a very specific answer other than I've noticed this going in a really positive direction and kind of taking away some of that stigma and opening up the door for these conversations to happen at least.
And I'll add that I spoke a little bit on it. The trauma-informed care model is something that we definitely have adopted more over the last 5 years. And it's something that kind of is pervasive throughout the hospital system, where we are educating people to be EB friendly across a healthcare system so that wherever that child or that teenager or young adult goes in a healthcare system, they don't have to have fear that somebody doesn't know something about EB or how to kind of reduce the potential trauma that could come along with providing care. So I think it's really kind of that community engagement within a healthcare system that has kept it safe and or just a really, I think, different model than it was 15 years ago when I started.
Thank you both. Yeah, I mean, to kind of bring both of your points together, the awareness and the conversation and the acknowledgement, to your point, Anne, and then resources that don't just start with the family but extend to all those involved with care or the family or the unit or the community. It is notable, right? And I think it's town halls like this and people like you both that continue that trend in the right direction, to your point. And look, we are just so grateful to you both for navigating such important and honestly challenging conversations and being so open to sharing your personal stories, for providing guidance, resources for everyone on this call. Again, I think you both, just the mix of the emotional and the personal and the professional and the practical is near unprecedented as far as I've seen in discussions of this topic, and masterful careers that you all have built to be here and share this knowledge with us. Dr. Jamie and Dr. Ann mentioned resources that they've shared, some of which on the call. We will put those together and make sure that we share those with the community. A couple that we were aware of in advance, but I know Jamie and Ann will have others, is NAMI, which is the National Alliance on Mental Health Illness. And they have a helpline, access to support groups, resources on mental health education for that both benefit the individual impacted by mental health, but also educating their larger community. And we'll provide some links and information with that, along with the resources from you, Jamie and Ann. Rare Minds is a mental health focused nonprofit that was specifically created for the rare disease community. And they offer online counseling services as well as a hub full of a variety of different resources. And lastly, Given Hour is a really, really amazing, wonderful organization that provides mental health support through an innovative approach that empowers those they help to actively take part in their own mental health journey. And they have a specific sub-focus actually on rare disease and offer peer support groups for caregivers and the ability to even train to become a peer supporter, in addition to access to a wide array of tools and resources. So we will send these out and we will combine them with your resources, Ann and Jamie. And just finally, thank you so much to our amazing and brave presenters, for each of you for taking the time to join us and hear from these speakers. Again, this is not the easiest topic to discuss, but certainly with the guidance and expertise of you both, Ann and Jamie, important and necessary and part of the growth to have these conversations more and more often, which is how we drive awareness and how we drive change and how we drive progress. And we hope you'll continue to join us for the monthly town halls. Sign up for the newsletter, follow us on social. We do these every single month. I want to thank the EBRP team, Allison and Margot and Katrina, particularly Allison, who many of you know. And if you don't, she is really the engine behind organizing these town halls and making them so seamless and organized and picking the speakers. And this was one that we talked about for a while of really wanting to do, but just to be honest and vulnerable myself, we didn't know the right way to do it. And it was really Ann and Jamie that gave us that answer. So thank you for helping us pull this off. And just thank you everybody for your support and for your presence and for being active members of this community. So if we don't see you before then, we will see you next month on the town hall. And thank you everybody so much for your time today.